Yeah, I was one of the pioneers in dermatological laser treatment in Australia. One of the very first doctors, ancient history, I suppose. I started off with the most primitive lasers, and now have finished up with probably the most advanced lasers in dermatological surgery. Yeah, Cutera have been the lasers I've chosen more recently because they've really developed the field so much in recent years. The most advanced lasers, the most effective and reliable, and provide an excellent service. So it's hard to choose any other company, I suppose, for that type of laser. Yeah, I just heard from colleagues who had purchased them, and these colleagues I had great faith in their opinion, and it certainly turned out to be right. I'd had plenty of experience in lasers, so I understood the principles of their lasers, and I knew that they were more advanced. And I'd been following that line of development in lasers over a number of years, so it was a stepwise improvement over 34 years. And so Cutera were the ones that just kept on developing them further. So you got rid of problems and adverse effects that you had with the previous older lasers, more and quicker. I think if you choose the right modality for the particular patient's condition, you get reliable, excellent results. You must know the nature of the condition though, and have a scientific understanding of that, and then know the application of the particular laser parameters that will give you the best result. And Cutera have done even more than other companies. They've provided a recommended settings for each physical condition. And you can go outside those parameters, but you're usually best to stay within them because they've been determined by obviously a panel of expert laser therapists. Well, there's two I have. There's the XLV, and that's obviously been superseded now, I believe, by the XLV Plus. So I'll now have to look at that in time. And also, more recently, 12 months ago, we purchased a Enlighten Pico laser, and that's been wonderful for treating pigmentation conditions, which I've always had a big interest in. That one we use the XLV, and the XLV Plus, I believe, has even an improvement on it. For pigmentation, however, for facial pigmentation, superficial pigmentary spots on the face and neck and legs, the Enlighten laser has been amazing in its advancement over previous lasers. I think even better than the XLV. So for vascular conditions, I prefer the XLV. For pigmentation, in most cases where it's flat pigment, the Enlighten Pico laser is my choice. I love it. Oh yeah, it's fascinating, yeah. Being a pioneer in the field, I always enjoyed discovering things new or learning things new, and the journey goes on. We keep on learning new things, and the standard of care of these patients has improved considerably because of the development of the technology and also the medical knowledge as the basis of the disease.